The flu, short for influenza, is a contagious respiratory illness caused by influenza viruses. These viruses infect the nose, throat, and, sometimes, the lungs, and they can lead to a range of symptoms from mild to severe. Influenza viruses are divided into three types, A, B, and C. Influenza A and B viruses are responsible for seasonal flu outbreaks, while influenza C typically causes milder respiratory symptoms. The flu is known for its sudden onset of symptoms and can result in outbreaks and epidemics, particularly during the fall and winter months. The severity of the flu can vary widely, and certain populations, such as the very young, the elderly, pregnant women, and individuals with weakened immune systems or underlying health conditions, are more susceptible to complications. The flu is primarily spread through respiratory droplets produced when an infected person coughs or sneezes. It can also be contracted by touching surfaces or objects contaminated with the virus and then touching the face. Preventive measures for the flu include annual vaccination, practicing good hand hygiene, avoiding close contact with sick individuals, and staying home when sick to prevent the spread of the virus. The flu can present with a range of symptoms, and their severity can vary from person to person. The most common symptoms of the flu include fever. A high fever is a hallmark symptom of the flu. It can exceed 100.4 degrees Fahrenheit 38 degrees Celsius and may rise rapidly. Body aches and muscle pain. Severe muscle and body aches are common with the flu. These aches can affect the entire body. Fatigue. Profound fatigue and weakness are typical flu symptoms. It can be more severe than the tiredness associated with the common cold. Headache. Intense headaches are often reported by individuals with the flu. Dry cough. A persistent, dry cough is a common respiratory symptom of the flu. Sore throat. While a sore throat is more common in colds, it can also occur with the flu. Runny or stuffy nose. While nasal congestion is more common in colds, some people with the flu may experience a runny or stuffy nose. Chills and sweating. Shivering and chills are common during the feverish phase of the flu, followed by sweating as the fever breaks. Nausea and vomiting. Some individuals, especially children, may experience nausea and vomiting with the flu. Diarrhea. Diarrhea can occur, particularly in children, but it is not as common as other gastrointestinal symptoms like nausea. It's important to note that not everyone with the flu will experience all of these symptoms, and some people may have symptoms that are more pronounced than others. The flu symptoms typically come on suddenly, and individuals with the flu often feel extremely unwell. If you suspect you have the flu, especially if you are in a high-risk group, such as the elderly, young children, pregnant women, or individuals with certain medical conditions, it is advisable to seek medical attention. Antiviral medications can be prescribed to reduce the severity and duration of symptoms if started early in the course of the illness. Additionally, practicing good hygiene, such as frequent hand washing, can help prevent the spread of the flu virus.